Welcome back to Falcons Tonight. My name is Dave and your host for Beyond the Headline. With me we have Dr. Reality White from the University of Technology Psychology Department. He has recently published his book, Depression, Is It Real? To my left, I have Dr. Jovan Kildare, traveling from all the way from Zimbabwe across the Atlantic Ocean. He has been practicing medicine for over 10 years. Dr. Kildare, what is depression? Specifically, situational depression.
With situational depression, we are talking about a stress-related depression. It is very short-term and it is attached to a very specific situation or series of events. This is why we call it a stressor-based depression.
Okay, very good, Doctor. Over to you, Dr. White. Typically, one would want to know, what are the signs and symptoms of depression?
There are many signs and symptoms of depression. The lack of enjoyment, disinterest in food, and also suicidal behavior.
Alright. So guys, viewers, you have heard the doctors, so right now we want to move on to ways it can be treated. So, Dr. Kildare, enlighten the viewers on the ways it can be treated.
Well, firstly, you cannot treat depression by yourself. You need to go and consult your doctor. Now, your doctor will give you the best method of treatment. Now, from my research and from my papers, I have discovered that CBT, which is cognitive behavioral therapy. Now, the reason why we choose this type of treatment is because situational depression, as I said, is stressor-based, which it means something happened and that is why the depression is constant and happening. If you treat that stressor base or that sign or that symptom, you can then remove the problem of the depression. Now, depression over time will lessen. So with the treatment and with time, you can reduce the effects.
Okay. So doctor, regarding the CBT, it says, according to my reading, it says it's a therapy which is an effective treatment for depression. So it helps to replace the negative thinking patterns with adaptive ones. So elaborate on that.
Yes. So we realize that if we help to change the mindset of the person and the connections in the pathways with the neurons in the brain, we can actually rewire the brain so that depression does not affect the person. So the stressor, when presented to the subject, will no longer have an effect on that individual.
Over to you now, Dr. White.
Yes.
What are the societal stigma associated with situational depression?
Well, there's a lot of societal stigma associated with depression.
Yes.
Persons who are depressed feel less of a person. They are incapable of living a normal human life. It is contagious and it also allows them to do crazy things.
If I could interject, especially when I come to Jamaica, I realize that in Jamaica we see depression as some kind of madness. Yeah. So people oftentimes, they do not want to go to the doctor, they do not want to report it, they don't want to tell anybody, and that is a big issue in Jamaica.
You're absolutely correct.
You have heard it from Dr. Jovan Kildare, and he has traveled all the way from Zimbabwe, and with over 10 years of practice, he has seen what he has seen in Jamaica. So now, Dr. Jovan, what do persons do when they typically feel depressed?
So, as I said before, depression should not be treated by yourself. Do not go online, do not look up things. What you need to do is go to your doctor. Now, I mentioned CBT as the part of my research that is one of the best ways of treating depression.
Yes.
However, there's also electroconvulsive therapy, and there's also the use of drugs, antidepressants. Now, this should be prescribed by your doctor, yes, and you will follow a medication plan of when and how you should take it. The electroconvulsive therapy now is in extreme cases, it is really just to get rid of the connection of the stressor and the individual to the trauma. So, I advise you, go to your doctor. Do not try to seek help on your own. Go to your doctor.
Yes, that is absolutely correct. And if I might add, talking to a friend, a family member about your issue or problem can also help in reducing your stress factors as well.
Okay. Alright, so according to my research, I want to speak more of the electroconvulsive therapy that Dr. Kildare mentioned. It's a medical treatment most commonly used in patients with severe major depression or bipolar disorder that has not responded to other treatments. So you have heard it from both doctors. The topic that we have just discussed is depression. Gentlemen, before we go, here is a video on situational depression, showing the signs and symptoms. 1. Lack of enjoyment. 2. Feeling overwhelmed. 3. Disinterest in food. 4. Sadness. And lastly, suicide. Please look to your right.
Depression really is a thing rampant in our society. It is very common and it affects a large group of persons, especially teenagers.
You're absolutely correct. It's a serious matter that needs to be dealt with. And I can see, did you see the fact that the students were actually having fun in the video, and the guy was like just passing. He did not have any
enjoyment. The lack of enjoyment is very evident in the video.
It's very evident.
And the last part, especially the last part, where you can see the most extreme symptom of depression, which is the suicide.
Yes.
It really is terrible, because a lot of our suicide rates are linked to depression currently.
Extremely linked. And the sadness, you know, you can see that a student at the gazebo needed some help, but he was feeling so overwhelmed.
It's changing behavior, very,
was
very
horrible. Oh my God.
Alright, you have heard it from the doctors. Depression, it's serious. More specifically, situational depression, experienced among university students, balancing school and also dorm life. I want to thank the doctors, Dr. Jovan Kildare and Dr. Reality White for taking the time out. I want to thank you for you, the viewers, for taking the time out to watch it. Is it stress or are you depressed? Know the signs. Seek help. Thank you.